All right, today we're going to break down a pretty critical gap in medical diagnosis. You see, it's all about how we see and, way too often, miss the signs of infection on different skin tones. And this isn't some niche topic, it's something that affects patient outcomes every single day.
So let's kick things off with a really foundational question. This is something every single medical professional, whether you're a first year student or a seasoned surgeon, is taught to answer almost without thinking. What does an infection actually look like?
And the classic answer, right? It's always redness, swelling, and heat. These are the cardinal signs, drilled into us from every medical textbook. So when we picture a skin infection, our brains immediately go to this bright, angry red patch of skin. But, and this is the big but, that's exactly where the problem starts. Yeah, this simple question just blows the lid off a massive challenge in medicine. Think about it. What do you do when the number one most trusted visual sign for infection is, well, basically invisible on a huge part of the world's population? Okay, so let's really dive into what we're calling medicine's redness blind spot. And just to be clear, we're not talking about some rare, obscure condition here. No, this is a fundamental flaw in how one of the most common diagnostic signs is used, or misused, across the board. So, why is this problem so deeply embedded in medicine? Well, it really starts with our training. Most medical textbooks, most lectures, they overwhelmingly show examples on lighter skin. So redness, or erythema if you want the technical term, gets cemented in our minds as the gold standard, the number one sign of infection. And what does that do? It creates this massive diagnostic gap for people with darker skin, where an infection can just be simmering under the surface, completely unnoticed, until it gets really, really dangerous. So what does this actually look like in the real world, in a clinic? Because this isn't just theory, right? Let's take a look at a direct comparison, and you'll see just how differently the exact same infection can show up. Wow, the difference is it's stark. Let's just take erythema, redness. On light skin, it's that bright, unmistakable red. But on darker skin, you should be looking for dark purple, maybe brown, or even grayish tones. And sometimes you just can't see it at all. Look at cellulitis. It might just be this subtle, deep darkening, almost like a shadow under the skin. A bruise? Forget blue and purple. You're looking for dark brown or black. The signs are absolutely there, but we've been taught the wrong visual language to read them.
And look, this is so much more than just a diagnostic curiosity or some cosmetic difference. We have to be super clear about this. The consequences of missing these signs are severe. We're talking truly life-altering outcomes. And here's the number one takeaway from that. Because that classic sign of redness is missed so often, really common infections, I'm talking about things like cellulitis, are constantly being misdiagnosed or diagnosed way too late. And that one single misstep, it sets off this whole cascade of terrible effects. It's like this dangerous chain reaction. Here's how it usually plays out. A clinician looks for red, they don't see it, and so the diagnosis gets delayed. The infection is only caught later when much more severe signs pop up, things you can't ignore, like a foul odor, discharge, or a high fever. But by that point, you're starting treatment at a way more advanced and frankly, a much more dangerous stage.
And what are the real-world stakes here? Well, they're huge. We're talking a higher risk of amputation, especially in the feet. We're talking infections that spread like wildfire, bone infections or osteomyelitis getting diagnosed way too late, longer hospital stays, more aggressive, invasive surgeries, and beyond all that physical damage, it just completely erodes trust. Patients start to feel like they're being overlooked, and that's a huge problem.
Okay, so the big question is, how do we fix this? Because it's crystal clear the old model just isn't cutting it. We absolutely have to upgrade our diagnostic toolkit and move beyond just looking.
The solution really begins with a shift, away from just our eyes and towards using our other senses. I'm talking about using our hands. Palpation, just feeling the area, becomes a primary tool. You can feel for subtle differences in warmth. You can feel for induration, which is just a fancy word for a hardness in the tissue. You can feel for swelling. And yeah, it also means paying attention to other things, like odor or any changes in discharge. And this is where technology becomes such a crucial ally. We have tools that can see what our eyes just can't. You've got infrared thermography, which can pick up on tiny temperature differences that scream inflammation. There's fluorescence imaging that can literally make high concentrations of bacteria light up. And then you have tools like a Doppler ultrasound to check blood flow if you're worried about ischemia. That's a really dangerous lack of blood getting to the tissue.
So, where does this all lead us? Well, it leads to a new standard of care that's way more equitable and honestly just more effective for everyone. And the key here is that we're not trying to change the standard of care. We're changing the methods we use to meet that standard for every single patient, no matter their skin tone. And this next idea, this is an absolute game changer. It completely flips the script on the whole diagnostic approach. Here it is. On darker skin, redness is a secondary sign, not a primary one. Think about that. It's not the first thing you look for. It's something you might use for confirmation if it even shows up. The real primary signs are the ones you feel. So this all boils down to a really simple but incredibly powerful new mantra. And this is something that can literally save limbs and lives. We need to replace look for red with look for change. Any change from that person's normal baseline.
And change isn't some vague idea. It means looking for a whole spectrum of signs. Is there a change in the skin tone? Is it getting darker, purplish, maybe a little gray? What about a change in texture? Does it feel hard or swollen or kind of boggy? Is there a change in warmth, in swelling? Is the person having a harder time using that part of their body, a change in function, or even a change in odor? These are the real primary signs we should be hunting for.
So this really summarizes the diagnostic divide and the path forward. For light skin, a visual diagnosis often works great and leads to early treatment. But for darker skin, to get that same early outcome, we have to lean on tactile and thermal diagnoses, what we can feel, and what technology can sense. And this is the bottom line. It's so important. Equal care doesn't mean the same method for everyone. It means using different methods to achieve the same high standard of care.
So we'll leave you with this question to think about. And it's not just for doctors or nurses. It's for educators, for patients, for the people designing our healthcare systems. The question is this: how can we ensure our medical standards see everyone equally? How do we rebuild things so that everyone gets the care they deserve? It's a big question, but it's one we all need to be asking.